I'm introducing Kim, who obviously is one of part of the family of TSG. So Kim, thank you very much for doing this. Kim is an advocate want to make sure I say this right, at Bethesda Legal Services, and provides legal assistance to caregivers and their families. She helps families navigate the maze of public benefits and plan for long-term care services. Through legal and legislative advocacy, community partnerships, and education, she develops and promotes policies to improve the quality of life and community care options for disabled persons, older adults, and caregivers. Kim, I'm turning it over to you with a big thank you.
Sure. Thanks for having me. I know probably everyone here. And I'm happy to be here with my other hat on, which is an advocate at Bethesda Legal Services. Bethesda is a legal aid agency, if you're not familiar with it. We're a law firm, and we're a nonprofit law firm. And we serve people throughout the county of Los Angeles who are low income, and we don't charge anything for our services. I'm in our Elder Justice Unit. I've worked at Bethesda almost 20 years. And our Elder Justice Unit helps people with different things relating to aging in Los Angeles, including conservatorships. We assist with restraining orders and all kinds of elder abuse issues. My specialty is home care and Medi-Cal eligibility. So I help people get in-home supportive services, which is a home care benefit through Medi-Cal, and help people qualify for Medi-Cal. And we'll talk a lot more today about Medi-Cal, what it is, what it pays for, and how to be eligible for it. We also help with planning, powers of attorney for finances, for healthcare, and we'll mention that briefly today. And we do wills. This is just our Elder Justice Unit, and Bethesda is much bigger, and I'll talk a little bit more about that later. I'd like to have this kind of informal. If you have questions, please raise your hand, and my wonderful husband is co-hosting with me, and he will call on you as we go, as we discuss some of these different issues regarding caregiving, caring for someone. How do you care for someone when they need help? So today I'm talking about long-term care. So that's different than like acute care when you get ill and you have to go to the doctor or you have to go to the hospital. That's acute care. But what I'm talking about today is long-term care, which is caring for someone who needs help with either physical or emotional needs for an extended period of time. Typically, an example you may be familiar with, someone has Alzheimer's disease. The diagnosis in the beginning, they're independent. But as the disease progresses, they lose independence and they're dependent on other people for almost all of their needs. That's someone who needs long-term care. Or even maybe a shorter long-term care. If somebody has a hip replacement and they need care for maybe 4 or 5 months while they're recovering, that's still a type of long-term care. There are two types of care long-term. And I'm making this distinction because the way care is paid for is based on what kind of long-term care it is. So one type is called custodial care. That's like help with activities of daily living. And the other kind of long-term care is skilled care. So that's care from a skilled medical provider. So custodial care is provided by non-licensed caregivers usually. You can hire somebody through an agency to provide custodial care. You can be in a nursing home and get custodial care. That's help with, bathing, getting dressed. In this picture, this woman's helping her mom get out of bed. That's a type of custodial care. That's in opposition to skilled care. Skilled care is medically necessary care that's either provided by a licensed professional or supervised by a licensed professional. You can get skilled care at home, like this man. He has a physical therapist come to his home and she's providing help with physical therapy at home. You can get skilled care in a nursing home. She could do the same thing in a nursing home. But this is more of a specific medical care. Wound care, IV care, catheter care, injections, physical therapy are all types of skilled care. Medical insurance and Medicare usually pays for skilled care, but it doesn't generally pay for custodial care. And that's where people run into trouble. Long-term care today, people who need long-term care today really face a maze of hurdles to get through to access care. Most people have never even heard of the word long-term care or had to deal with it until they're in that situation or their family members in that situation. Typical calls that I get at work is a woman who's working, taking care of maybe her kids at home, and her mom has a stroke. And all of a sudden, her mom, who is independent and living in her own home, is now in a nursing home after the stroke and is looking at a very long rehab. It could be 6 months, it could be a year, it could be longer than that. And the daughter's trying to figure out how can I care for my mom now? How do I pay for this care? How does my mom pay for this care? Can I take care of her? Who's going to take care of her? Because mom can no longer go to the bathroom on her own. She can't shower on her own. Maybe she can't walk on her own. So now all of a sudden the daughter's faced with, how do I take care of somebody long term? And the problem is that it's really not a cohesive answer. It's a disintegrated system of medical and social supports that are not cohesive. There's all these paths to walk down to get long-term care. You can't, it's not just like a one-stop shop. You call your doctor and your doctor will help you through it. It just unfortunately doesn't work that way. And as people are aging, there's more chronically ill people who need long-term care. It's very challenging. And more seniors are alone. The older adults are alone and they're relying on non-family for support because maybe they're, my folks live back east in Pennsylvania. If something happens to my mom or dad, it's going to be very challenging for me to take care of them because I live so far away. So how am I going to help them get the care they need? So that's what we're going to discuss today. So when you think about long-term care, it's a continuum. It can happen at home with family caregivers. I could take care of my mom. Paid caregivers, I can pay someone to take care of my mom, or maybe Medi-Cal will pay someone to take care of my mom, or maybe I have long-term care insurance to take care of my mom. There's daycare for adults, kind of like childcare for kids. There's also daycare centers for adults when someone's living at home. They can get care during the day at a daycare center. That's part of long-term care. Home health care is part of long-term care. Hospice care and case managers are all players within providing good care for somebody when they're in their home. If someone can't stay in their home, they could perhaps go to an assisted living. Assisted livings are also called retirement home, Alzheimer's boarding cares, small boarding cares, which are single family homes, maybe have 6 people living there, people with disabilities or older adults who need care. These assisted livings are licensed by the Department of Social Services. So they're not healthcare facilities, they're really custodial care facilities. There aren't nurses on staff there. Another place that people can go when they need long-term care is a nursing home. A nursing home is also called a rehab center, a convalescent home. These are actual medical facilities. There are nurses on staff there. They may have an Alzheimer's unit for people that need specific Alzheimer's care. And they provide long-term care to many, many people in Los Angeles who cannot stay safely at home, don't have family members to care for them. Nursing homes are licensed by the Department of Healthcare Services, so that's an actual healthcare facility. And then a hospital where short-term acute care is provided to people. So people can go back and forth between being home, going to the hospital, maybe going to rehab nursing home for a while, going to home. So it's fluid, the continuum of long-term care, but these are the different distinct spaces where people can receive long-term care. And then these same spaces, how do you pay for the care in these different spaces? It's challenging to navigate that because there are different options. So I've listed them out here. For home care, Most of the time, it's private pay. You pay out of your pocket for home care. That's what most people do because unfortunately, Medicare does not cover most home care, and we'll talk a little more about that. Medi-Cal pays for long-term care at home through a program called In-Home Supportive Services, which is a pretty good program. We do a lot of work with that program. If you're lucky enough to have long-term care insurance, that also pays for home care if that's what your policy covers. And if you're a veteran, or you're married to a veteran or were married to a veteran, you may be eligible for home care benefits through the VA. They have a special benefit called aid and attendance. So I'm throwing all this information at you. I've been doing this a while, so I know how it's all paid for. But if you are in the situation where you need long-term care, even if you're a veteran, the VA may not tell you, hey, you may be eligible for this. Unfortunately, it's hard to find this information. Hopefully someday it will be easier. The state now is dedicating a new department to aging and having goals in the aging arena as to how the state's going to assist and support people who are aging and their families. So hopefully it will change. Right now, it's very challenging to navigate. Assisted livings. Most people who live in assisted living, it's private pay, just out of pocket. That's how you pay for an assisted living. Medi-Cal does pay for limited assisted living, long-term care insurance, and VA aid and attendance, which is a stipend for home care, can also be used in assisted livings. For nursing homes, you can private pay for that. Nursing homes are very expensive though. Most people in nursing homes for long-term are on Medi-Cal because it's so expensive. And I'm going to go through some of this with my slides. I'm going to break it down. So we went through some of the payment systems. These are the four payment systems for long-term care: Medicare, Medi-Cal, private pay out of your pocket, and long-term care insurance. So you probably heard me mention Medicare does not pay for custodial care. It doesn't pay for long-term care. So what is Medicare? Medicare is a health insurance benefit that's linked to your Social Security benefit or your spouse's Social Security benefit. So if you get at least $1 in Social Security, you will get Medicare, which is health insurance, when you're 65. Or if your spouse gets Social Security, you will be entitled to Medicare benefit. Medicare starts at age 65. Or if you're disabled by Social Security disability, like if I become disabled, I can't work anymore, and Social Security says I'm disabled, I actually have to wait 2 years until my Medicare starts. So in between that time, I have to figure out my health coverage, but after 2 years on disability, I would get Medicare. Now, Medicare only pays for acute care and rehab care, not custodial care. So Medicare pays on an average 14 days in a nursing home. The benefit is up to 100 skilled days in a nursing home. So someone has to go to the hospital for 3 days and then be discharged to a nursing home on Medicare. And then Medicare will pay for up to 100 days in a facility. But most people don't get that. So a lot of people believe when they're discharged to a facility that they're going to get that 100 days. It doesn't work like that. Medicare only pays for the skilled care. And once the doctor at the facility says you don't no longer need skilled care, Medicare stops paying. So people would think if they go to a facility, they're going to have Medicare pay. But unfortunately, that's not what happens. Medi-Cal, as opposed to Medicare, is a public benefit. In the state, the federal government calls it Medicaid. California likes to be different, so we're Medi-Cal. It's our own benefit here, but it's the federal Medicaid benefit. California has its own rules. Each state has different Medicaid eligibility rules based on the federal guidelines. So there's some flexibility for each state. So what I'm going to speak about today for Medi-Cal eligibility is only for our state. Every state will be different. So Medi-Cal is a public benefits. So someone has to have low income and low assets to be eligible for Medi-Cal. Medi-Cal doesn't generally pay for an assisted living, but it does pay for a small program called the Assisted Living Waiver. Many people want Medi-Cal to pay for care in a nursing home because Medi-Cal pays for long-term care in a nursing home. So my grandmother, she had Alzheimer's disease. My grandfather took care of her for quite a long time until he couldn't do so anymore. And then he placed her in an assisted living. When the money ran out and he could no longer pay for the assisted living, she went to a nursing home. And Medi-Cal paid for her in a nursing home for almost 7 years until she passed away. So that's often kind of the process that people go through, go up to different levels of care as their condition worsens, or when they run out of money. If they can no longer pay for an assisted living, they can go to a nursing home on Medi-Cal once they run out of money for their care. Medi-Cal also pays for home care through in-home supportive services. It pays for up to 283 hours a month of home care based on that person's needs. And there's another program, Medi-Cal program, called the Home and Community-Based Alternatives Waiver that pays for even more care, which is a great program. Medi-Cal pays for adult daycare, which is also a really good benefit for people, and it pays for case management. Medi-Cal really has the most robust home care, long-term care benefits, but unfortunately you have to be pretty low income and low asset to access Medi-Cal benefits. There are attorneys who specialize in Medi-Cal planning that help people plan for long-term care. So if someone has a diagnosis where they know that they're going to need long-term care in the future, they can go to a Medi-Cal planning attorney who can help them come up with a plan. I also do Medi-Cal planning. We work with people who are lower income, lower asset. So if we can't help, we refer them out to a private attorney for Medi-Cal planning. But that's a lot of what I do too is, if someone's diagnosed with Alzheimer's disease and they know down the line, or they have Lou Gehrig's disease, it's going to get a lot worse. It's good to start planning for long-term care at that point, really at any point. So let me talk about Medi-Cal eligibility, because I mentioned what a good insurance and coverage it is, and let me tell you what you have to do to get Medi-Cal, or a family member to get Medi-Cal. So there are different kinds of Medi-Cal, just to make it even more confusing. There are many different kinds of Medi-Cal. The type I'm talking about right now is Medi-Cal for people who have Medicare. Okay? If they don't have Medicare, it's maybe different rules. So if they have Medicare, this is the Medi-Cal rules. So there is no income limit for Medi-Cal. So someone could have $5,000 a month in income. They may still qualify for Medi-Cal, but they may have a high monthly deductible called a share of cost. There is an asset limit for Medi-Cal, and that's the hurdle that people have to jump through in order to get Medi-Cal. So see that guy, he's jumping through a hoop. The hoop you have to jump through to get Medi-Cal is the asset test. So for an individual, that person's assets have to be less than $2,000 in countable assets. So it's very, very low asset. That number, $2,000, has not been raised since 1989. So it's very challenging to live with $2,000 in reserves, and that's it. But that's the income limit right now for Medi-Cal. And for a married couple, they have to have less than $3,000 in countable assets to qualify for Medi-Cal right now. There are some special rules, though, for married couples. If one person in that couple needs nursing facility level care, and nursing facility level care doesn't mean they're in a nursing home. It just means that they need help with their activities of daily living. They need custodial care. They need help bathing, maybe dressing, maybe walking. That's nursing facility level care. So if the couple is married and one person in that couple needs nursing facility level care, help with the activities of daily living, then that couple can have a much, much higher assets and still qualify. So instead of $3,000 in countable assets, that couple can have up to $130,000 in countable assets. So this is a very special program. Many people are unaware of it. It's so special that many Medi-Cal eligibility workers are unaware of it, even though that's their job to be aware of it. So if you know people that really need Medi-Cal, that need help in their home so they can stay at home, or they need to place, well, really it's at home that workers are not familiar with this asset limit. People really can have some savings. This special program is called Spousal Protection Program. It's supposed to protect the well spouse from impoverishing themselves to take care of the sick spouse. So keep that in mind if you know somebody who would be able to benefit from this program. In Medi-Cal, there are some things that are not counted. Your house is not counted as an asset, right? So you can own $1 million home and you can qualify for Medi-Cal. The home that you live in, the home you own is not counted. Or even if you own a home, I have many clients who they own a home, but they become so ill they have to move in with their daughter, let's say for care. That home is still not counted because they're allowed one home, even if they can't live in it. Also, if somebody has retirement accounts, they are not counted. So someone can have $100,000 in a retirement account. It is not counted as an asset if the retirement account is paying out periodic payments of principal and interest, the required minimum distribution. So once I think you're 70 and a half, it may have been raised recently, you must take out minimum distributions. If you're taking out distributions, the 100,000 in the account is not counted. Or if you're not taking out distributions and Medi-Cal would count that 100,000, you can just change it, start taking out distributions, and then the money in the account is not counted. So there is some flexibility with some of the assets. And there's a lot of complicated rules I'm not going to go into, but just these are general eligibility rules for Medi-Cal. Any questions? Okay. So let's talk about what does it cost? How much does it cost? What does it cost for these different types of care? Just so you know, what's the reality, the landscape out there. So if you just want a chore worker, someone to help you clean, help you take a bath, help walk, that kind of thing. So these are unskilled people. There's no licenses for chore workers. They're unlicensed. In-home supportive services pays the workers $15 an hour. You probably pay out of pocket $15 to $20 to $25 an hour for you hire someone privately. That means they're not bonded, right? If you go through an agency, you're looking at easily $20 or more per hour for a home care worker. That's not skilled. Okay, so it's not an RN or an LVN. You're just talking about somebody who's just doing this without training. Daycare centers. If someone goes to a daycare center, it's $75 to $150 a day. Medi-Cal will pay for an adult daycare center, and some centers work on sliding scale based on someone's income and ability to pay. Assisted livings, retirement homes, boarding cares, they're about $4,500 plus per month. People can find them for less. You can get them for maybe $3,000 a month, maybe. The smaller boarding cares, and they really vary. I don't know if you've looked at them at all, but it really varies in the amount of services that you get for the $4,500. If you need skilled care at an assisted living, they'll start tacking on extra fees for those, whether it's hourly or however that assisted living works for supplemental care. And nursing homes, this is the Medi-Cal rate, $10,298 a month. That's what Medi-Cal pays a nursing home to take care of somebody. If you're private paying, it'll probably be more than that. So it's, as you can see, it's very, very expensive to have nursing home care and pay out of pocket for any extended period of time. I wanted to mention paid family leave. I hope you're aware of it. It's a great program. California has a fantastic paid family leave program. New parents can take paid family leave, but also if you're caring for a seriously ill family member, California pays for up to 8 weeks of leave to take care of that family member. And you don't need to take it all at once. You can take the 8 weeks, 1 week or 2 weeks at a time. You can take some hours each week. It's paid through the EDD. So where you file for unemployment, you can also file for paid family leave there. It's a really great benefit. So if you pay into unemployment as an employee, you're eligible for paid family leave program to take care of a family member. So I want to mention long-term care insurance. We talked about this Friday at ONEG, and I was just so astounded, really, and pleased at how many people had long-term care insurance, because I rarely meet people with long-term care insurance. So long-term care insurance is insurance that pays for long-term care. The policies vary. The younger you buy it, the cheaper it is. There are pretty high monthly premiums. I just looked it up today. And for a couple who are 60 years old, like the average rate was about $280 a month for long-term care insurance. It's really not, there's no real good market protections on long-term care insurance, so they can raise the premiums. And if you can't pay it, you lose your insurance, even if you paid on it for years. So if you can afford it, it's very good to have, but it is pricey. It's good for moderate to high asset individuals. And depending, so if you're going to buy long-term care insurance, you should make sure that the policy pays for the kind of care you want. And most people want to stay at home. So you want to make sure there's a robust payment for home care, if that's where you prefer to be. Or assisted living, how long does the payment last for the assisted living? Some of them have limits on how long they'll pay for care. The best policies have inflation protection. So it's like any other insurance that you would shop for. Who decides care? Okay, so I work with families, and a lot of people have different ideas of what kind of care they would like. And sometimes the children have different ideas of what kind of care mom should have than mom has. Ultimately, the patient should decide the care if they're able to do so and able to do so safely. I'm in many situations where working with a client who wants to stay home, and it's really not safe for them to stay at home anymore, but they don't want to leave their home. And that's their choice, as long as they're cognitively able to make that decision. It can be very challenging. Sometimes we work with mediators or social workers to help work with our clients to, one, make sure their care needs are met, and two, maybe talk to them about other options if it's not safe for them to stay at home alone anymore. Patients' surrogates, meaning a family member or agents for powers of attorney, can also decide. Sometimes my clients think, oh, the doctor is going to decide my care. Yeah, obviously, the doctors don't decide care. They can advise, but not decide what kind of care, what level of care. The role of the doctor's office is really to respect the patient's choices and offer support in whatever their choices are, and educate the patient about potential long-term care needs. But I find generally, unless someone's working with a geriatric care physician, physicians are very unfamiliar with Medi-Cal eligibility or even custodial care and how to pay for it at home, because that's not what they do. They don't do long-term care. They do acute care. If there are social workers or geriatric care managers at the doctor's office, they are wonderful resources to connect the individual to all the community resources out there for long-term care. I know Kaiser has a wonderful geriatric care department, and I work with the social workers there all the time to help figure out how can we support an individual in their long-term care goals. And when we talk to somebody, we talk about, what are your goals? Do you want to stay at home? Do you want to go to an assisted living? Is that where you are now in your care? Or what are the family goals? How can the family support you with this? It's really a matter of teamwork. Caring for someone long-term is a team effort between the physician, the family, the individual, social workers, and all the other supportive services out there to help them stay safely wherever they are. I just spoke a little bit about the considerations in care. You know, where do you want to get care? Where is it feasible? What can you afford? And who's going to support you with that care? Are there family members that can support you? Sometimes I work with families and there's 4 children and one child is doing the caregiving and maybe one child's helping pay for supplemental caregiving and one child is doing all the financial statements and talking to the healthcare agencies. I mean, that's like a super functional family and you'd be really happy to have that family. Sometimes there's 4 kids and one kid is just taking care of mom, doing everything, and the other kids aren't contributing. So, you know, who's going to help provide care if somebody needs it? And the cost. I mean, ultimately, the level of care and the kind of care that someone can get is dependent on the cost and what they can afford. And the future care needs, you know, is looking down the line. Could mom move in with a family member? Is that an option? If not, do they need to move to another part of the state so they can be near a child? There's all this planning. Social workers are great for helping with planning for care now and in the future. Another part of planning outside of just planning for long-term care, for the physical care of that person, is cognitive issues, planning for long-term care decision making. I'm a big proponent of everybody having powers of attorney for finances and healthcare. Hopefully, everyone on this call has one. Powers of attorney are legal documents where you appoint someone else to make healthcare decisions for you if you are no longer able to do so. So you don't give up your decision-making ability until you're no longer able to make decisions. If you want to appoint someone to make decisions now with you or to talk to the doctor, you can have someone else and appoint them as your agent now. But ultimately, it's up to you to make any final decision. Your agent doesn't get to override what you want, what your decision is, as long as you have the cognitive ability to make that decision. Powers of attorney for finances. You appoint someone to make financial decisions for you if you're not able to do that in the future. So that's accessing bank accounts, selling a home, mortgaging a home, handling health insurance. Many people assume because you're married, you're going to have access to your spouse's account. Not true. Like Steve has a private account. I can't get into Steve's account, even if I'm married. Even if he's disabled and in the hospital and he can't speak to anyone, I cannot get into his account. I cannot get into his retirement account as his spouse. I have absolutely no authority to take money out of his retirement account to care for him unless I have a power of attorney for finances or a conservatorship. So it's really important to do powers of attorney for healthcare and finances to prepare for the unexpected in life. And I'm happy to talk to anyone about those if you have questions on those. I wanted to highlight resources available at BetCedec. We publish a whole series of guides. These are like pamphlets, maybe 60 pages long. One called the Caregiver Companion. So it's kind of like what I talked about today, all these different issues surrounding care and decision-making and paying for long-term care for someone at home. The Assisted Living Companion talks about care in an assisted living and the residents' rights, the legal rights for someone who lives in an assisted living. We have one called the Nursing Home Companion too that talks about nursing home residents' rights. And then the final booklet is In-Home Supportive Services, which is specifically about the In-Home Supportive Services program. And we have all kinds of great guides on our website too. So take a look at it. It's a wonderful resource and they're all free. You can download them. Here are some other resources for long-term care. I don't know if you're aware of this, but the whole state of California has a caregiver resource center everywhere in the state. We have the Los Angeles Caregiver Resource Center. It's run at USC. And these are free services for caregivers to support them, for caregivers taking care of anybody with a cognitive issue, and I think maybe for any other serious health issue. So they have support groups and social workers that will meet with people, help do some of the long-term care planning that I was talking about. So it's a great free resource. Also, Alzheimer's LA has lots of supportive services for caregivers to help take care of the caregiver. There's our phone number. There's a website called Benefits Checkup. So you could go in and plug in people's income and asset information, see if they're eligible for benefits. And the California Advocates for Nursing Home Reform is a wonderful agency that helps people who have problems with nursing homes or residents' rights in nursing homes, which has been a huge issue during COVID. Being able to see people that live in nursing homes, making medical decisions for family members in nursing homes, and they've been strong advocates for nursing home residents and their families, and they have great resources at their website, and you can call them too. So I wanted to just tell you a little bit more about BetSEDEC. We've been around for almost 40 years now. We started in the Fairfax area serving people that live in Fairfax, and now we serve the whole county. We have lots of specialized programs. We have a Holocaust reparations program that's been going on a long time. We provide free assistance filing for reparations for anybody in the world who's a Holocaust survivor. We have an employment rights department where we provide free legal assistance to people who are victims of wage theft. They've worked and their employers refuse to pay them, or slave labor. We've had clients who have been enslaved, wrongly enslaved, and we've assisted them in getting their wages during that period. We have a huge program with homelessness assistance and eviction defense work. So we help people who are being evicted stay in their units, and homelessness assistance. So if you would like to donate to BetSEDEC, there's our link, and we are a nonprofit agency. And I'm proud to work here. We do great work, and it's a good place. So I appreciate you listening to me about long-term care. I know it's not a very sexy subject, but it's important, and you will probably know somebody who needs long-term care. So it's good to know that we are a resource for people, and the basics of what's available to people. That is my direct phone number. That is my email. Feel free to contact me if you have questions about Medi-Cal or long-term care or elder abuse or anything like that. I'm happy to speak to anybody.
Kim, Ruth Jacobson has a question.
Ruth?
Actually, I just put up a clapping emotion reaction because I think that was great. But sure, I have a question. I can kick off questions. So I was interested in the portion of your presentation about long-term care insurance, because my mother, I recently had a pretty negative experience with long-term care insurance. And when I have pursued it for myself with financial advisors, they usually tell me better to invest money in your own funds than purchase that insurance, because then I have discretion. Have you heard anything about that, or are there policies out there that kind of address that concern with long-term insurance?
I don't know, because I don't work with long-term care insurance, but I know that there's certainly one of the schools of thought is invest the money. You know, it just depends how much money you have to spend for insurance, because it is pricey. And you know, you don't know if you're going to need it or not, or how long you're going to need it.
Yeah, it's just in the case of my mom, my parents paid for decades on a policy that I think we ultimately got something like $5,000 out of it in benefits, because it was waiting for them to determine she qualified when. Right. So that was just, you know, I do, from what I've heard, newer policies are doing a better job of kind of addressing that problem.
Yeah, I know the older person policy, some of them only paid for like care in a facility and not at home. But they have changed, but I'm really not that familiar with long-term care insurance.
Seth had a question.
Seth?
There's a commercial I'm hearing on the radio. It's actually for a financial planner, but they have someone ask him a question about long-term care insurance. And his reply is, if you're rich or if you're poor, don't worry about it. Because if you're rich, you can you can use your money to pay for it. He doesn't define what rich is, by the way. And if you're poor, you can get help from the state and from the federal government
Yeah.
to do it. He said in the middle range, if you're middle class, maybe you want to think about it. And so my question was going to be, what do you think about his answer?
I think he hits the nail on the head, because really the middle class people are the ones who there's no support system for that, right? There's nothing to hold the middle class if they're falling, right? Because the Medi-Cal will provide assistance for people that are low income or low enough to qualify. And if you're wealthy, it doesn't matter. But what is middle class is ultimately the question. And if you're middle class, can you afford the long-term care insurance is also the question, right? You're kind of like, it's just like the rest of life. Like, what's going to happen? Am I going to need long-term care or not? I hope not, but I might, I have no answer for you, Seth, but he's correct in his analysis. Yeah.
Jane Barrios has a question.
Thank you, Kim, and thank you for putting this on.
Yeah.
Yeah,
Jen?
hey, Kim. So my mom passed away a couple of years ago. We went through a very long time of a lot of everything you just did in your whole slide. I think I hit every single resource that you posted, and I learned it all on my own.
Yeah.
I even called Big Cedic at one point. I can't remember what came of that, but I don't think it was that helpful at that point. And I'm trying to remember why my mom didn't qualify for Medicare. She didn't own a house. She rented, and I'm trying to remember, I think it was her income. She was considered a wealthy Social Security recipient.
Yeah.
She got $1,700 a month,
Yeah.
but $1,000 of that was rent.
Yeah.
So she couldn't qualify. I think that was the reason she couldn't. I'm trying to remember now. It's like I put it all out of my head. It was just
Yeah. Well, Jen, I mean, if her income was $1,700, I mean, I didn't go into the Medi-Cal eligibility criteria. I didn't do a deep dive. This is just an overview, but she would have had a high deductible. Even with an income of $1,700, she'd have a high deductible for Medi-Cal. Now, there are some things she could have done for that, and that's what we advise people on what to do. And it's kind of a cost-benefit analysis. How much does she want to spend to get Medi-Cal? And there are some things that she can do, but how much benefit is she going to get from spending the money? So that's what we do with people. Like, if someone's in your mom's situation and they have a high deductible, but I'll just tell you, this is crazy the way Medi-Cal works. If her income is $1,700 and she qualifies otherwise, her monthly deductible is going to be $1,100 for Medi-Cal.
Right, I think that might be what it was, but her rent was already $1,000, so she was living off of $700 a month. So
Right.
my friend's mother, who owns a house,
Yeah.
was able to get her Medi-Cal, but I
Yeah.
couldn't for the life of me get my mother Medi-Cal. It's very frustrating.
It's very frustrating. And single people with income like that are hardest hit. I mean, and the Medi-Cal rules have kind of, they've changed over time, and there's an amalgamation of all these weird rules, and hopefully they're becoming more equitable. But we're not quite there yet. Yeah. Your mom was kind of in that hole.
Maggie has a question.
I just wanted to say how looking at the idea of $10,000 plus a month is pretty horrifying.
Yeah.
That's all.
Yeah, it is. And what happens is people spend their money quickly, and
Yeah.
then they go on public benefits.
Yeah.
And part of the movement too is now, I mean, no one thinks I want to get old and be in a nursing home, right? No one wants to go to a nursing home. And if
Right.
the state is spending so much money on people in nursing homes, isn't there a better way to support people and use less money to keep people at home? Like Jen's mom's situation, right? she maybe if she could have gone to a nursing home and Medi-Cal would have paid, but that's not what maybe she wanted. I mean, I know your mom's situation, Jen, but to just allow her to stay home and get the support that she needs instead of not qualifying her. It's
Yeah, my parents stayed home and had a woman who came for a while, came in, and then for a while lived there.
Yeah.
So and that sounds like a nicer way to be, because you can stay in your home.
yeah.
That,
Yolanda,
that should be a goal, right? I mean, my mom, unfortunately, I think if we had had the availability of that kind of care for her, she might have been able to have a less traumatic aging.
Yeah.
But
And
I don't know that that's always doable.
yeah, it may not always be doable if they don't if you don't have support, if there's no family nearby, or people aren't, people are working and they can't be there during the day. It's very challenging. It's
Kim,
very
Yolandi had a question, and then Ruth Jacobson.
Thank you, Steve. Thank you, Kim. Another fabulous presentation. I just wanted to clarify when you were talking about Medi-Cal for Medicare and that a couple can have less than $3,000 in assets. And I don't think you defined assets. Does that include Social Security or pension monies?
Yeah, so income is not counted as an asset. So when I say less than 3,000 in assets, it means what's in their bank accounts at the end of the month. That's the asset. So regular income, pension, Social Security is not an asset. Someone can get $3,000 in Social Security, and at the end of the month they have zero, they have no assets.
Thank you, Kim.
And Yolandi Erickson and Gail Tamler are on this call, and they are my esteemed colleagues from Bet Sedec who have tons of experience and just are so dynamic. And thanks for joining us, Yo.
Ruth?
Well, yeah, I'm really enjoying this presentation, not only for myself, but as a future nurse practitioner. I'm like soaking all this in so I can be knowledgeable. And I wanted to ask, I'd heard in my NP training about respite care as a Medicare benefit. It seems like a newer thing. Do you know anything about that? And is it going,
That would be amazing. I don't know about it. No, I don't know about it. If you know anything about it, let me know.
My impression is it's a relatively new thing they're trying to begin in Medicare coverage, and I'm not sure. I think it might be more established in the East and back out here.
Medicare is a nationwide benefit, so if it exists in Medicare, I'll look it up and see. But if it's back east, it will be here as well. So thanks for bringing it up.
Susan Hain, and then Carol.
I was just going to say about respite care. I know when Andrew was younger, he got respite. We got funds to cover respite care for him, but I think it's almost like daycare.
Well, regional center pays for respite care.
It says depending on he lost it after a while when they realized that he could have just a regular old babysitter because he didn't need anything special.
Yeah, and Medi-Cal will pay for respite care too, in that you could place somebody in a nursing home if the caregiver needed a break for a while. Logistically, it's challenging, but they do. Medi-Cal will pay for some respite care. And adult day health care is a kind of respite care, and Medi-Cal pays for that. Medicare does not, unfortunately. Yeah.
Carol, you're on mute.
Kim, thank you. You've done a great job and really explaining it. I was thinking how glad I am and thankful that you're working with social workers, because this is a really stressful time for families. And I think that the more disciplines that are involved, the better, because we all look at things a little differently.
Yeah. Social workers are my partners.
Steve Smith. Steve, you're on mute. You're still on mute. Still on mute.
What is the definition of respite care?
Respite care, my understanding for respite care is just giving the caregiver a break.
Is what?
Giving the caregiver a break, like respite. So if I'm taking care of my mom 24 hours a day and I am the only one there, I need a break sometimes. So respite care is Medicare, or well, I don't know if Medicare does, but you know, I could hire somebody to come in and give me a break. That would be respite care. It's giving the
And,
caregiver a break.
That's the definition of respite care. And who pays for respite care?
Yeah, that's a good question. Usually it's just private pay out of pocket. Sometimes like Alzheimer's Association has grants for respite care, or Los Angeles Caregiver Resource Center may have grants for 8 hours of respite care a week. I mean, if someone's taking care, being a caregiver is very challenging. And oftentimes the caregivers end up getting sick and predeceasing the person they're taking care of, especially in spousal situations, because it's so difficult being a caregiver. So those caregivers need a break so they can continue to take care of themselves and then take care of their loved ones. So respite care is really important, but not generally part of a benefit.
I just looked it up, and Medicare does have a respite care benefit where the person can have 5 days, but it sounds like you have to go into a hospital or some facility for that.
Yeah, yeah.
You have to go to a retirement home for respite care?
You don't have to go to, I don't know what the Medicare benefit is. It's Maggie's saying it sounds like you might have to go to a nursing home probably for respite care. So
And it would pay up to 5, it would pay up to 5 days?
Maggie said maybe, so I don't know. But it's a federal rule, so if it does, it should. And there may be other qualifying criteria. I don't know, but if you're interested, just email me. I can look it up and we can talk about it.
Steve Smith is off mute.
Now, am I unmuted?
That is correct.
Yay. Okay. Medicare Advantage plans. I wonder if there are any Medicare Advantage plans that offer any kind of long-term care to supplement this.
Yes. Medicare, some do. I'm trying to think off the top of my head. Independents at home used to. Some Medicare Advantage plans do offer that as part of their package.
I'll look into it.
Yeah, but it may be short respite care, it may be short caregiving, depending on your needs. But yeah, you could look into it. Check Kaiser too. I don't, Kaiser has pretty robust benefits, but I'm not sure.
I'll look into Kaiser.
Yeah.
They are robust, economically, they're very robust.
Yeah.
Good point. Okay. Thank you.
Kaiser also has a great financial assistance program that I haven't seen in other Medicare HMOs, that if you don't qualify for Medi-Cal, they will pay for the copays for prescription drugs and procedures and things like that. So that's a great benefit through Kaiser. Because it can get expensive. Medicare only pays 80% and people are responsible for the other 20% unless they're in a Medicare Advantage program or have a supplemental plan.
I don't see any more questions out here.
Awesome.
Oh, but I see Jen just raised her hand.
Just a caution I would just do with Kaiser, because we're a complete Kaiser family, and my mom had Kaiser, and I was really excited to meet the geriatric groups and the social workers in that group. But I mean, unless you're really like, I couldn't, the only way they would recommend anything for us, I had to get my mom to them for appointments and she couldn't move. So their restrictions are so severe, that most hospice places beg you to take your patient, or my mother in that instance, off Kaiser, because Kaiser couldn't. Their restrictions are just so stark you know, and Medicare, I think if you're in like a Blue Cross or a different situation, there's more flexibility to take care of someone.
Yeah. It's very, you know, what you're bringing up, Jen, it's so complex, honestly. The whole system, unfortunately, is so complex because, like Steve was saying, which HMO is better? Which is going to offer more care now? What am I going to need down the line? It's paralyzing for me, and I do this for a living. You know, I can't imagine, you know, someone, maybe an older adult who has mild cognitive issues trying to get through this and even just pick a plan that's best for them. It's very challenging. It's a broken system. And how to best navigate a broken system, you know, use resources around you to help. There are, like, Center for Healthcare Rights is a legal aid that helps people navigate Medicare. It's free for anybody that has Medicare, and you can call them and they can help you do that analysis. So there are some resources out there to help, but yeah, it's hard.
Steve Smith has his hand up.
Steve.
I do. And it will get, I hate to put a little dark tinge on this, but it's going to get harder in answer to what Kim said. Wall Street's very interested now in the baby boomers, the age wave of baby boomers getting older and more needy with these issues. And one has to select what plans they go with, what HMOs, PPOs they go with very carefully. Kim, you're a good resource, and thank you for this.
You're welcome. I'm here for you guys.
Ruth Jacobson, if you want to speak what you wrote in the chat, that'd be great.
Okay, well, I was digging around in my notes because it was starting to bug me, like, what was this thing? So I think what I might have been thinking of is this newer program called PACE. Which,
Oh, PACE? Okay, I can tell you about PACE.
Okay.
But PACE is a Medi-Cal program. So if someone has Medicare and Medi-Cal, they can enroll in the PACE program. It's the program for all-inclusive care for the elderly. It's only in certain geographic areas. So there's a place called the Brandman Center. It's in West LA. No, sorry, West Valley. It's in the West Valley. And there's one called Ultimate, which is like mid LA. And if you're in that catchment area, you can enroll for your Medicare and your Medi-Cal. And that is very all-inclusive. It's like a one-stop shop. But it's like an HMO too. You have to go to their facility for medical care or who they contract with. But they have on-site daycare, podiatry, psychiatric care, dentistry, geriatric care, physical therapy. It's all at one site. And they also pay for home care. And Respite Care would be part of that. They contract through agencies to provide home care, which is a nice way to do it. Medi-Cal, if you're not in PACE, the in-home supportive services program is not contracted through an agency. So it's a little more challenging to find providers. PACE is a very good program, but it's very geographically limited, and you have to give up some flexibility in your care because you have to assign all your care to the PACE program. So it's good for certain individuals, but just depends. Thanks, Ruth.
Bernice asks, how can she get this presentation if she missed the first part of the presentation?
Can we have Jason email it to everybody? Like,
That could be done, yes.
Okay. Bernice we'll just email the congregation the recording. Thanks, Bernice, for asking.
This was excellent. Thank you very much.
It was fabulous. Kim, thank you.
You're welcome.
Woohoo!
Thanks.
Great job.
You have my email, you know where to reach me. So I look forward to talking to any of you if you have questions about, you know, your family or just general questions. I'm here.
Kim,
Yeah.
do you want us to call you during the day or after work?
I would really like you to contact me on my phone number I gave you or my email I gave you, because you might get lost otherwise if it's work related. That's my work. You know, that's how I get my work input. If you call me on my private line, it's not connected to my work.
Okay, that's better.
Yeah.
Okay, and you're going to send that out in a PowerPoint to us or the notes? I don't have your.
I can send the PowerPoint, right, Steve? Can Jason send the PowerPoint?
Yeah, Jason can send the PowerPoint, right, Susan?
Yeah, he can. Well, this has been recorded, right?
Yes, it has.
Oh,
It's in the
well.
cloud.